of human resources at Partners Healthcare at Home. Our main office is in Waltham, Massachusetts, and we have offices throughout Northeast region. I must say that it was an extraordinary time for us in the HR world here, as I'm sure it was in everyone's world that was trying to adapt and cope, going from the PGGM experience, jumping right into how to support staff in the most effective way in the field. And I think we did a great job. The team here did a great job. And I have to say, being part of a large system certainly helped us. I think, one of the things that we jumped into right away was remote work. And we were lucky in that we had prepared through emergency preparedness our staff, our administrative staff, to be ready for remote work, really through snowstorms along the last year or so. So when we had to, on a dime, switch to have most of our administrative staff working remotely, we were able to do so and have continued to do so for safety reasons. And we plan to really through next June. There are some staff who do come in the office to support distribution of PPE and reception and our referral services, but many are working from home. And although we have some policies around that, we have liberalized them so that, of course, staff can take care of dependents, their children, surely, and then other dependents they may have at home. Normally, remote workers were not to be responsible for dependents in their home setting. So we had to relax that for obvious reasons. And we found that our staff is coping well and performing their jobs pretty efficiently. So that's been fabulous. Sort of other lessons learned through the process was just, as always in any kind of situation, is communication. Just the importance of keeping it flowing. And certainly what I'm using right now to communicate with Tim in this interview, Zoom and Teams and other functionality came in so handy. We had daily Zoom meetings, both the HR staff, our senior staff, our managers with their teams. And this really helped in terms of getting the proper infection control measures out to our staff, of keeping everybody in the loop as to what the changes coming down that we needed to adapt to were, and how staff could get their PPE, what the means were, as well as doing a daily newsletter out to staff. And we have kept we've always had a newsletter for our staff, but we certainly kept that going and had it published daily. I think that was very, very important. Some of the other things we did policy-wise certainly is, to make sure our staff were covered for their time out. When they were testing for COVID, we make sure that they're covered, their time is covered. Certainly if they became positive, we covered that time, made sure that they were covered with their benefits and their pay. And we even covered our staff whose workload was diminished so that we didn't have to do any furloughs of staff, which I think was very important. And we were able to accomplish that by redeploying people to other important functions and jobs within the company. So I think there were a lot of lessons learned. We tried to do everything we could to be supportive through our EAP programs, by working with staff who needed accommodations, also redeploying some of those staff who needed accommodations, and to really just work with people where they were at. We found people were willing to do what they could to make things work, and we're still finding that to be true. So it's a kind of, we call it flying the plane while trying to keep the engines running when they're kind of failing at times. And we're able to do that. And we're very grateful to certainly all the field staff that have been out there throughout this whole period, seeing thousands and thousands of patients and doing a fabulous job. And certainly the HR staff have been super supportive. I think that could be, I think that is true. Even with our HR team, we used to meet as a team only monthly, and now we were meeting daily during the crisis, the height of the crisis, and now we've continued to meet weekly. And I think that's just helped us to stay on the same page. And I know that the clinical teams have been doing some of the same. And I think it's been easier for us being geographically spread out all the way from New Hampshire down to Cape Cod and out to 495 to bring people into meetings who are geographically dispersed now that Teams and or Zoom is so accessible to us, to bring people together who normally we'd be struggling trying to get into our Waltham office for something. At the same time that the COVID was going on, of course, we had the Black Lives Matter movement become so prominent. And we were able to hold meetings with our staff across the whole system, invite people to participate in Zoom meetings to talk about their experience and how they felt about some of the things that were happening nationally. And it would have been, much harder to do that, just getting people in the office, where people can drop into meetings a little easier when they can just get on their computer, which they have accessible to them. Everyone has one now, and they either get on their phones. A lot of people just have their cell phones very handy and can use those. So I think we have learned a lot of lessons. I agree. We've probably all changed forever, right? Because of COVID in so many ways. I think a lot of emphasis is being put, on virtual visits. I would say we're doing virtual visits. We're emphasizing virtual visits and trying to integrate them more. I thought it might take off a little more than it has with staff. I'm a little surprised that they're not leaning more toward using virtual visits. I would think it might be, to some degree, a good tool in their toolbox to check in with patients and maybe save some time. So I'm curious to see how that goes over the long term as people become more used to using that. So I think certainly in terms of remote work, of course our field staff has worked very remotely in our business, at least in this agency. People were not used to coming in the office a lot. Maybe in some agencies they still do, but they didn't come in that frequently. They came in for team meetings, for maybe some other meeting reasons, but they're pretty remote. Our administrative staff will probably be much more remote than going forward, I think. And maybe we'll be, getting into, different kinds of work that we haven't been doing up till now. We'll see how things have changed, but I think we probably have all changed permanently.
Yeah, that's great. You've got some really good snippets there that we can definitely use. Anything else that you want to say that you haven't yet?
I don't think so. A lot of the stuff that we did, I think is, more stuff that, is not to be carried forward, but stuff we were just doing to kind of manage through. One thing we're doing right now is we are doing surge planning right now. We're very engaged in that to be ready if there is a surge, and trying to understand staffing, which understand how we will do that with our staffing. I think that we're not unlike many agencies from what I've heard, and that we do have some issues with staffing right now. We have lost some staff because of COVID. People have moved to jobs that are not so direct patient facing. Some staff have, others we have found that we're able to recruit, and others are attracted to home care. But I think people are making decisions. Yeah, I'm surprised how many people maybe are moving and doing different things with their lives. COVID has made people, I think, sit back and think about their lives a little more. And what do I want to do? What are my goals? So people have been making changes during this period. You might think that people might be stagnating, but I found that not so much. People are moving on with their lives. So, some obviously deciding to retire, but so we're having to cope with that as well. And it's, of course, it's a challenging time to do that. Well, we're, doing all our interviewing on Zoom. It's all done remotely, and it's we're doing, for instance, Indeed. We've used Indeed to do virtual job fairs, where our recruiters are doing an all-day event where they talk to different people who make appointments to do a short interview, an informational type of interview. So instead of coming into the office and meeting, they're meeting on Zoom, and then making appointments with managers and doing interviews on Zoom. We are doing some portion of our orientation in-house, in person. We have arranged for our orientation to people being 6 feet apart. They are masked. But another big portion of it that used to be in person is now done remotely, using Zoom and Teams. So that has changed how we're doing that. Many of the things that we had to do, checking I-9s and that kind of thing, we've been adapted through doing remotely as well. So a good portion of what used to be done when people would come in and meet are done via electronics now.